Hi, this is Dr. Rankin. Welcome to our series of videos all about your recovery. If you're watching this, it means that you are somewhere along your surgical journey. Either you're looking at having surgery or you may be post-operative and may actually have a drain in place. So the topic of today's video is going to be drain management. What is a drain? A drain is essentially a very small, usually silicone tube. This happens to be one of the smaller ones that we would use for a neck lift or facelift, some sort of facial rejuvenation. But essentially the idea is that by using this and this little reservoir attached to it, that we can create a little bit of negative pressure to actually draw fluid out of that area, which means that you are swollen for less time, you recover faster, get back to life faster. Ultimately, we want to make sure that this is working well. So the fundamentals here, there's a little bit of a drain that will be somewhere inside so that it's exiting your body. It's going to be attached to this bulb. The way this bulb works is that the walls of the bulb want to be expanded. And so in order to make sure that this is creating negative pressure, we need to compress that and then plug that in order to make sure that it stays compressed. If this is not staying compressed, then that means that it's time to either empty the bulb, which means you just go ahead and empty that fluid into a little cup, take a measurement. Otherwise, there are small numbers on the side that represent milliliters. And so this would be 25 or 50 milliliters, though that is, it's not going to be as accurate as if you put it into a small cup. Ultimately, if for some reason this is staying expanded, despite the fact that you have compressed and you replugged and done everything like you're supposed to, but it continues to do this, it means that there is something wrong with the system. And then I would encourage you to either give your doctor a call, or if I'm your doctor, give me a call. Otherwise, the drain, the other common questions are, there's no way that even when you are emptying things that anything is going to go up the drain because there's a very small valve in here that will prevent any sort of backflow of air or fluid. Otherwise, this drain is all the same size all the way along the course of the drain, which means that when it does get removed, there shouldn't really be any discomfort. I don't anticipate that you'll have any pain. Many people don't realize that I've removed the drain at the time of their drain removal. So ultimately, recap, we want to make sure that this line is open and that the natural resting state is that that bulb is compressed. As long as this is compressed, it means that it's creating negative pressure and actually drawing that fluid out of your body. As you get a few days into your recovery and the output has reduced, we want to make sure that that line stays patent and that the fluid continues to empty well. And the way that we do that is milking the drain. And so you're going to pinch close to your body, and you ultimately will then go ahead and strip the drain, release, re-grab and pinch, and then strip the drain again. That way it will ensure that that line remains clear and open and that it continues to work so that it can help you to the best of its ability. Around the time that we are seeing less than about 1 ounce per day, or less than about 30 cc's a day, it's time for that drain to come out. And so again, that's a great time to give your doc a call or give me a call so we can go ahead and get rid of that drain. Surprisingly, nobody wants to keep these. Anyway, so again, recap, keep that drain open. If this guy continues to do this, please give us a call. Otherwise, simple basics, you're going to go ahead, compress, reinsert that, and just make sure that the drain looks like this all the time. If you have it in your pants or something like that that's constantly pushing on it, that means that it's also not doing its job. So we want this to be supported. You don't want it hanging on you, but we do want this to be in this compressed state so it's continuing to draw that fluid off. If you have any other questions, please give your doc a call, give me a call. I look forward to taking care of you.